Good evening, everyone. Bonsoir. Sam, wow, what an evening. It's just incredible, and it is a pleasure to bookend this evening with a discussion of brain, just as we started, and specifically about the intersection of brain and ethics that we call neuroethics. So we're going to go to the next image, and this is a Canada-led, wide, global partnership. It involves both laboratories in the developing world and even those in under-resourced countries of the world. What are we trying to do? We're trying to align innovations in neuroscience with society and culture and individual human values. And we're trying to do it through high-impact research, through education, and I have some of the most wonderful trainees here with us tonight, and outreach. We're trying to take away the S and the Y out of scary, take the middle, and turn it into caring. How are we doing this? We're doing through a landscape of neuroethics. We're thinking about brain science in its context of public discourse, social policy. How do you and I exchange knowledge? How do I help to increase your neuroscience literacy? And how do you help me to understand the literacy that we need to bring to neuroscientists? We're talking about communication in multiple directions. We're talking about you and me and you. We're talking about the ethics and the practice of brain science, clinical and non-medical applications of neurotechnology. How do we prevent disease? Do we want to predict neurologic disease? Do we want to predict it when there's no cure? How do we improve diagnosis and treatment? And our landscape, as Sam so well introduces for us, our third landscape is really the neurobiology of consciousness, responsibility, how we make decisions, and whether or not we have free will. So let me give you some examples of work that we're doing in neuroethics at UBC today. We're trying to bring forward research on multicultural understandings of brain disorders across the lifespan. We're working with communities, Canadian Aboriginal communities, some who are at risk for early onset Alzheimer's disease, living in very rural, remote parts of Canada. How do we help bring understandings and resources together collaboratively to aid in the management and, in fact, wellness of this disease as it affects early age adults in the 50s and early 50s. I'm going to ask you to go back a slide. How do we bring ethical research and treatments and diseases, treatments and diagnoses to children with neurodevelopmental disorders, autism, attention deficit disorder, CP? And again, let's think about Canadian Aboriginal communities. And in fact, we've learned in developing these research projects collaboratively that today there is, in some communities, no word for child in these communities. If you could advance a slide, please. Thank you. So how do we bring research to this topic when, in fact, our language, our fluency isn't even there yet? You heard about mental illness from Shimi earlier. We're working in the areas of stem cells, spinal cord injury, and multiple sclerosis. How do we bring the right treatments to the right people at the right time? We're working in the area of gene therapy. We're using social media to understand what the public understands about gene therapy. We're noting a lot of confusion. If we can go on to the next slide, thank you. What I'd like to do is present to you 4 neuroethical challenges that I want you to think about, and I invite you to interact with me through email. And we're going to focus on brain imaging signals of the brain, whether they're structural or metabolic or energy-based. And so the first example is one that I've dealt with a lot. Imagine yourselves as research participants in a brain imaging study. You enroll as healthy volunteers really wanting to do good for research. Unexpectedly, an abnormality is detected in your brain. And in 1 in 5 of you will have an abnormality that may or may not be significant. In about 2 out of 100 of you, about this chunk, that abnormality may be medically significant. Would you want that information fed back to you from the researchers? They're just researchers, not clinicians. If we start to do that in research, are we starting to blur the boundaries between research and clinical medicine? Would you like to have the right not to know, to opt out? What are the responsibilities? Let's go to a second case, a real-life case. I want you to think of an individual, an upstanding member of our community who starts to become aggressive and exhibit great interest in childhood pornography, goes over the line, ends up in jail, starts to have headaches, gets scanned. It turns out there's a big tumor in the front part of the brain. Tumor is removed, goes back to jail, but has now become a seemingly completely socially balanced individual. Was that pedophilia the person? The person's brain? Was it the person's tumor? Should this person remain in jail? So my question for you is, how do we want to interface new neuroscience knowledge that we're acquiring every day and the criminal justice system? If I may have the next image. Here in Vancouver, we are a model of harm reduction in dealing with the people in our communities who have addiction. But as we understand addiction more and more as a brain-based disease, how should we as a community, as a responsible society partner, to really take into account the whole person, the whole biopsychosocial concept of an individual in these communities? And my fourth neuroethics example for you is one that I think we're going to see hot on in the Vancouver Sun tomorrow morning. We are starting to develop in our research laboratories the ability to use brain signals to understand whether there's more going on in the brains of individuals who have suffered terrible brain injuries and who have lost the ability, who are in minimal states of consciousness, who have lost the ability to interact with their environment, to respond to physicians. Brain signals may now be able to help us understand if a person is in pain, to communicate with their loved ones and potentially recognize them. And the challenge I want to ask you is, if we can advance the research that far, should we use it to empower individuals in these minimal states of consciousness to tell us about their pain, or to make end-of-life decisions and communicate them to us through their brain signals? So with those four challenges behind us, I come to the great neurosurgeon Wilder Penfield, great Canadian neurosurgeon, who wrote, just as Sam brought in the analogy to the stars, neuroscience is more important than outer space. The secrets of the brain and the mind are still hidden. And so I invite you to partner with me in this Neuroethics Partnership in Vancouver, Canada-wide, to really negotiate and help us understand the relationship between the self and society and the mind and the brain, and to unlock those secrets for the benefit of people with neurologic diseases meaningfully, respectfully, and ethically. Thank you so much.